Welcome everyone to today's webinar. Looks like we're recording excellent. We'll be able to share that after the webinar. But welcome to Hello Heart, Goodbye Stress. We're so glad that you joined us today to talk through such an important topic. I think certainly we can all relate, right? And it's likely why we're all on here today, having managed through stress at one point or another, certainly to varying degrees, I'm sure. Maybe we're even stressed out today as we speak, right? And certainly there certainly seems to be sort of an ever-pressing quest to find better ways to manage our stress. And this management becomes even more critical when you consider just how taxing stress can be on the heart. So let's talk a little bit more about that today. Again, welcome. My name is Jennifer Wagner. I'm a director of solutions consulting at Hello Heart on the medical affairs team. My background is in public health and chronic disease epidemiology in particular. For over 10 years now, my focus has been on healthcare strategy, largely in the employer benefits space, public policy, and also digital health. And I will turn it over to my colleague Paula to introduce and get us started.
Thank you, Jennifer. So my name is Paula Cerqueira. I'm also a director of solutions consulting here at Hello Heart. So along with Jennifer, work on our medical affairs team. My background is actually as a registered dietitian, but in the last few years, I've been working more in population health and research associated with that. So looking at why people make the decisions that they do related to their own health and trying to see how we can impact that for the better. So previously was at MIT and Tufts University doing that research, but am now at Hello Heart, and I'm so excited to be able to share this information with you today. So before we jump in, let's take a quick look at what we'll be covering today. So first, we'll talk about how stress affects your heart, because while most of us think about stress as a mental thing, it actually has a powerful physical impact on heart health. Then we'll walk through how Hello Heart can help you to take care of both your heart and your overall well-being. So we'll show you how the app makes it easy to monitor your numbers, get personalized guidance, and stay on top of your health. Then finally, we'll wrap up with a Q&A. You can share your own go-to stress busting tips or ask any questions that you might have. So we've left some time at the end of the session to answer some of those questions. And besides that, we can go ahead and get started and talk about the connection between stress and heart health. So before we jump into that, just a quick few housekeeping notes. If you'd like to ask a question at any point, go ahead and use the Q&A portal. So you'll find that at the bottom of your screen. We'll save time at the end to answer as many as we can, but feel free to submit them throughout the session while they're fresh in your mind. Now, if you'd like to turn on closed captioning, you can do that by selecting the CC icon on your screen. And just a gentle reminder, please do not share any private health information in the chat or Q&A. This is a safe educational space and we want everyone to feel comfortable participating. All right, now that that's out of the way, let's jump in. Let's talk about stress. So we all experience it, from the big things like caring for loved ones or managing work demands to the small daily moments that pile up. For me, it's anytime a piece of technology all of a sudden stops doing what it's supposed to be doing. That's when my stress levels really peak high. But while stress is a normal part of life, it's how our bodies respond to it that really matters. When stress becomes constant, when we're always in that on mode, it can start to take a real toll. And it's not just on our mood or our sleep, but also on our hearts. So this next session is all about understanding that connection. So how stress shows up in the body and why managing it isn't just about feeling better emotionally, but about protecting your long-term heart health too. So these numbers are hopefully going to help me tell the story. We'll start with the basics. So 76% of people report experiencing at least one symptom of stress. That's 3 out of every 4 of us. So it's nearly universal. I also don't know who the 1 out of 4 of us is because I've never met someone that is not constantly stressed out. But it could be that I'm friends with a lot of moms, so that probably makes a difference. Now, in the workplace, 65% of employees say that they've experienced burnout in the past year. That means exhaustion, lack of focus, and that feeling of, again, being constantly on. I bet a lot of us here very much know that well. But on a serious note, chronic stress isn't just a feeling, it's a physical risk factor. So, research from the American Heart Association shows that people with higher cumulative stress have a 20% greater risk of developing cardiovascular disease, including heart failure and coronary artery disease. So, when we talk about managing stress, it's not just about improving our mood or productivity, it's about protecting our hearts.
All right. And I would say this is an exceptionally timely webinar, especially given that the holidays are nearly upon us. It's hard to believe. We know that while it's a joyous time for many, it can also be stressful, right? As we're planning, we're checking off our to-do list, trying to hit all of those items. We're hosting family. And then also, certainly a tough season to navigate through in cases where loved ones are no longer with us, right? So we know all of this can take an enormous toll on our cardiovascular health. And so with that, we wanted to share just some simple thoughts on how we might be able to get ahead of this stress and protect our hearts. And it's not rocket science, right? Here are some simple things we can do. Recharging, number one, is so crucial, right? Reminder to take a break during the day, really at any time, but certainly at that moment of overwhelm, right? Sometimes you just have to step away, get out there, take a walk. The weather is beautiful this time of year. It's very brisk, right? That natural sunlight is so good for our bodies. Maybe even, if you can't get outside, if it's a rainy day, walking in place for 10 minutes, walking around your house, just kind of stepping away, maybe doing some stretching, any kind of movement that can help us lower that blood pressure kind of in the moment and help us reset, just stepping away and resetting. It might even look like doing, a breathing exercise for a minute or two, right? Some deep breathing. Paula's going to actually guide us through one in just a moment, but being able to regulate your breathing is going to be able to regulate your BP. Another one, of course, let others help you, right? Don't be afraid to accept help. Don't be afraid to ask for it. I think it's very difficult for many of us, myself included, especially if you're a type A individual. And, certainly as Paula alluded to, us mothers sometimes aren't so great at asking for help, right? So, just a reminder to embrace that collaboration, ask for help. It's really important to be able to distribute that stress load. And you'd be, again, amazed at what that can do in the moment for your stress levels, for your blood pressure. Another one, certainly, I'm guilty of not adhering to this one, but try to really step away from work during lunch, right? Get away from that computer screen instead of, mindlessly kind of shoveling it in while you're trying to get some work done. I'm very guilty of this. But it's better to step away, even grab a buddy, right, for a few minutes to join you to chat over lunch, have some meaningful conversation, or maybe some much needed alone time to listen to a podcast or read a chapter in a book while you're eating, something like that. But really take that time to refresh and recharge. And then lastly, I'll just note, take a minute to take stock in the resources at your disposal, right? And really look at what is offered to you through your organization and leverage them. So things like, your EAP that is offered through your employer benefits and well-being resources, any kind of stress management programs or mental health support that may be provided. Again, all of these things are at your disposal, excuse me, and they're there for your well-being. So use them. I'm going to turn things back over to Paula now for a moment just to walk us through a little bit of an activity that I hope will help us all lower our stress levels today in the moment.
So I have a few activities that I can suggest, and these are all activities that I actually do myself quite frequently. And then I'm going to walk you through one of them and we'll do that together. So the activity we're going to do together is box breathing. So that's actually something that even Navy SEALs use to lower their blood pressure and to lower their heart rate in the moment. So that's what we're going to focus on. But want to also suggest a good option is progressive muscle relaxation, or PMR. So basically, all you do for that one is that it's a quick muscle relaxation exercise. It's great for releasing stress you might not even realize that you're holding. And you start by tensing your shoulders, lift them towards your ears, hold for a count of 3, and then release. So you keep doing that over and over again, and it's a reset for your body. The other one that I'd recommend is just taking a lovely little dance break. So this is my number one tool for managing my own stress levels. It's especially great and something that I did before this presentation. So usually before any presentation I do, naturally, like you get a little bit nervous and your heart rate increases and your body kind of has to catch up to that. So if you do a little bit of exercise, including like dancing, having fun, it actually, what happens is your body assumes that the heart rate increase is due to the exercise that you're doing and not because of nerves. And it's a great way just to like calm your whole body down. So definitely encourage that. But why don't we all together, we're going to do a box breathing exercise. Now, this is best for when you need a grounding moment in your day. It helps people relax and feel a clinical calm. So we're going to take a quick moment to reset. This is simple. It's very powerful for calming down your nervous system. And what we're going to do is everybody breathe in for a count of 4, hold for 4, exhale for 4, hold again for 4. Now let's do that 2 more times. So breathe in for a count of 4, hold for 4, exhale for 4, hold again for 4. Last one, breathe in for 4, hold for 4, exhale for 4, hold again for 4. So this kind of mindful breathing helps slow your heart rate, lower your blood pressure, and it brings your body back into balance. Something that I'm sure your heart really appreciates. So again, suggest if you find that you're in a moment of stress, just break that out. You can do it anytime, even if you're on the go. And I always think it's really helpful.
That was great, Paula, and I feel better already. Thank you. I think sometimes we have certainly good intentions to take on, all of the approaches that I kind of walked through and even some of these breathing exercises that we just did, but life gets in the way, right? Things get busy and we don't have a minute, we feel, to sit down and do an exercise like that. It can all be a little easier said than done, right? So I think it's important to note that many of us could benefit from a little extra support, right? A timely nudge in the right direction. And Hello Heart can really be that critical support system that provides, not only a complete picture of your cardiovascular risk, but will offer tools for managing your stress and for lowering your blood pressure appropriately and for making heart healthy choices in general. And all of that is very, very timely to help kind of capture you in those moments, nudge you, remind you to, okay, this is a time to really take a minute. Let's pull it out. Let's read the app. Let's take some of these recommendations to heart. And it almost, forces you to focus in that moment and do what's necessary for your blood pressure and for your heart health. So want to just kind of do a bit of an introduction to our solution here for those on the line who may be curious about enrolling, and certainly a refresher for existing users on the line, perhaps a reminder of of the value that you can really tap into here. So we are a digital hub focused exclusively on cardiovascular health, really leaning in on, innovative technology and behavioral science principles to guide us to optimal heart health, right? So those who qualify and enroll are issued an FDA cleared Bluetooth enabled heart monitor that you see here, a blood pressure monitor that pairs directly with the Hello Heart application. And then once we've got those powerful tools in hand, really the user has the ability to manage their cardiovascular health through tracking blood pressure and other associated risk factors regularly. Importantly, Hello Heart is also helping the user to detect early warning signs of a serious cardiovascular disease event. So, flagging things like critically high blood pressure or irregular heartbeats, right? Certainly things that can be brought on as a result of high stress. And then being able to swiftly connect that user to their care team as appropriate in that moment of need. And importantly, as I've alluded to, we're offering timely, highly personalized guidance to you on your health journey, serving up recommendations and tools that are really going to work for you as an individual. It's a very personalized experience. And at the end of the day, we're making it incredibly simple for the user to be able to share all this information back with your provider through the auto-generated clinician report that you can certainly access with a click of a button very simply through the app. And so again, on the next slide, just a note for those of you who are eager to get started and try it out for yourselves and really, again, tap into the value that Hello Heart brings from an overall, health journey, heart health journey, but certainly from a stress management perspective, can see kind of how you can work on that through the prompts within the app. Just a few quick steps here, and really you're on your way. So visit join.helloheart.com, and then you'll enter the organization that you're affiliated with and to create your account. And then from there, you download the app and log in to get started. It's really as simple as that, and you're on your way with just a few steps here. If you do need help throughout the process, there's an email there and a phone number you can reach out to, support@helloheart.com. And we have folks available 24/7 to be able to answer any questions with setup that you may have. So it looks like we've got about 13 minutes left for Q&A. So we can maybe roll right into some of these questions. We actually had a number come through from you all ahead of the webinar, which we're excited to dive into. I don't think we'll get to all of them necessarily, but we're going to try to answer as many as possible. And certainly if there is time, we can get to some. I think a few came through the chat as well. But Paula, I've been talking for a little bit, so I will let you jump into the first of our question set.
Yeah, happy to jump in. So one of the most frequently asked questions that we received is, what are the early signs of heart trouble? The issue here is, and then I feel like I'm like the doom and gloom in this whole conversation here. Jen gets to come in with all the happy moments, and I'm the big bummer of the group. But the issue is that with heart trouble, early signs aren't always dramatic. So, what's really important is that we watch for subtle changes like shortness of breath, chest pressure, especially with activity, excessive fatigue. This appears a lot, especially with women. You're starting to feel a lot more tired than normal. That can actually be a sign of poor heart health. Swelling in your feet or ankles. And then the last one I would think of is more heart palpitation. So if you're starting to feel more frequent heart flutters in your chest. The other thing is that sometimes heart disease can show up as jaw, back, or arm discomfort rather than sharp chest pain. And again, this is especially typical in women. So you're really, any kind of off symptom that you're feeling, you really want to reach out to your primary care physician or your cardiologist to make sure that they're aware of that. No symptom is too subtle. And the most important thing that you can do to address this is to make sure that your care team is aware. A similar question that we got to that is, how do I know if chest pain is from my heart or something else like GERD? So the important thing to know is that heart pain can often it feels more like pressure or a heaviness or squeezing, and it can radiate against your arm, your jaw, or your back. It can come with sweating or nausea as well. Again, the nausea symptom, again, more typical in women. GERD pain instead is usually sharp or burning sensation. It can be related more to meals, and it often improves with antacids. The one thing that I'll say is that if you are at all in doubt, don't guess, make sure to get checked out immediately. I'll pass it to Jen to take on a couple more questions.
Yeah, I can I think bundle maybe two of these together here. They're along the same lines, but the first question is, how accurate is the Hello Heart blood pressure monitor? How can I tell if it's calibrated properly? And then what should I do if my readings seem inconsistent or require multiple tries? So I'll start by saying Hello Heart, the monitor itself is FDA cleared for home use. It's been validated for accuracy against medical grade devices. So we use A&D and ZWA devices. They've undergone independent validation studies by third-party observers as part of the manufacturer's clearance process. So essentially, the devices are quality assured by the manufacturer before even shipped to us. And what we have seen consistently is that when they are used correctly, when the cuff is on properly and you're sitting upright, you're following, the in-app instructions that we guide the user through to make sure that they're taking an accurate reading. When all of that is done accordingly, the cuff's readings are actually accurate within plus or minus 2 millimeters per mercury. So plus or minus 2 points compared to a clinical grade blood pressure monitor. If you're taking your readings and they seem inconsistent, or you feel like you need to do a multiple tries to get where you think is reasonable, I'll say first and foremost, again, inconsistencies are going to most likely result from user handling, right? If it's motion from the user or posture or cuff placement issues. And so I would say first and foremost, make sure that you're following protocol, you're sitting upright with, both feet flat on the floor. You're resting quietly for at least 1 minute before measuring. I think that's a really important one, and one that we certainly don't always remember. Especially, this is one of the main issues we see when we're flying into the doctor's office and we're making an appointment in the nick of time, and then they sit us down and they take our blood pressure. There's really no room for that. Let's sit for a quiet moment and get calm. Unless, of course, you have a doctor's office that keeps you waiting for quite some time. But maybe your blood pressure is elevated in that case when you're waiting for a while. But I think keeping the cuff on a bare arm on your left arm is recommended, making sure that it's 2 inches from your elbow and your arm is positioned at heart level. All of these things are crucial to make sure that it's a accurate reading. You want to avoid talking, avoid moving during the measurement, and taking the reading at the same time each day also helps to kind of reduce those natural variations and get something that's a little bit more consistent, because your blood pressure will ebb and flow throughout the day depending on activity and stress levels. And so I will say that from a user handling perspective, if at the end of the day, of course, if it is determined that maybe there's an issue with the device itself, again, it's rare, but if maybe there's a leak in the cuff or the tubing or something like that, again, there's always that availability to contact our support team, and then we would swiftly, replace that, send you a new one, and get that taken care of immediately, free of charge.
Same thing if you need a larger size cup as well.
Yes, yes, that's a huge piece of it. Absolutely. We do offer multiple size cuffs. Paula, you want to take a
Yeah,
couple more?
listen, I'm on a roll with doom and gloom. I'm dressed all in black, so I'm going to take another a sad one. So the question I got was, can you have severe heart blockage with no symptoms? And unfortunately, the answer to that is yes. I mean, that is the reason why a lot of times, like high blood pressure, high cholesterol, cardiovascular disease is considered to be a silent killer. It's what makes heart disease tricky. So plaque can build silently for years. And routine blood pressure, cholesterol, and glucose checks, knowing your family history, all of that is the best defense. And then beyond that, like again, thinking about all of the early signs that we already talked about. But the number one recommendation that I can make to you is please continue to see your primary care physician. They're going to do a blood lipid panel on you. They are going to check your blood pressure. You already have the Hello Heart blood pressure cuff at home as well, but it's important that you visit your primary care frequently, at least on an annual basis, to make sure that you are getting your levels checked. That is definitely going to be your best defense. Another question is, what causes heart palpitations and when should I be worried? I feel this question. I also am someone that has heart palpitations and irregular heartbeat. Their palpitations are often harmless. So that is, I get to be sunny for a little bit. So they're often harmless. They can be triggered by things like caffeine, stress. Dehydration is another big one, and then lack of sleep. So basically, again, all of the signs of normal motherhood. But the thing is that if palpitations come with dizziness or shortness of breath, chest pain, even obviously fainting is a big one, definitely call your doctor. So, I mean, that is going to be the overall message that you leave with from me today is if you have any concerns, always make sure to loop in your primary care. That is what they are there for. I'll pass it to Jen for a couple more questions.
Great. My goodness, it's only 4 minutes left. Okay, I'll try to maybe take two more here and then certainly can follow up with the group on any additional questions that we want to get answered. But this one is my blood pressure is higher when I first take it. Should I average readings or use the lower reading? So again, first and foremost, if your monitor is connected to the app via Bluetooth, right, your readings are going in automatically on all of the readings that you're taking, right? The application tracker is capturing every single one to help you kind of make sense of all of these readings. The auto-generated clinician report is going to ultimately showcase a 3-month summary of the readings that includes your average reading. But just, for your own personal knowledge and in general, you should always take the average of 2 or more readings versus using the lower one. Again, it just kind of helps to account for other factors like stress, like physical activity, things, the fluctuations that are going on right throughout the day. And I will just mention too, if you are taking back-to-back readings, you should at least leave a minute in between those 2 readings. So it's kind of an important thing to remember. So actually, because if you're consistently taking your blood pressure on the same arm over and over again without leaving much room in between, it actually can cause a higher reading each time. So you want to make sure you're taking that break. So the other question is, how do I see irregular heartbeat alerts on the device? So an irregular pulse alert is going to appear first directly on the blood pressure monitor's screen. So we'll automatically identify an uneven pulse, and then we'll be able to kind of display a small heart icon with an irregular rhythm symbol. So that it often will look like a heart with a zigzag or flashing lines next to your reading. We do not diagnose the type of arrhythmia, but the monitor will signal that it's detected uneven heartbeats during measurement. And then, of course, will help guide the user to have that conversation, perhaps with their provider, and do a little more in-depth discovery if it's something that's repeating, time and time again, if we're getting that irregular heartbeat reading. But really, what's happening on the monitor, of course, when it syncs with the application, it's communicating to the app. So you're going to get educational messaging on that irregular heartbeat. Again, as I said, coaching that will direct the user to connect with their care provider if this is something that's persisting. And then also, this will also be captured in the clinician report component as well. There'll be like a little flag or an icon in the tracker's history. The history chart. So it's nice to have it all comprehensive in one place there for your clinician to take a look at. But with that, I think we're just about at time.
It's
So
time.
yes,
Yeah.
so we want to thank you all for joining us. I hope we're all gonna come away from this webinar with some useful tips and tricks to work on our certainly our blood pressure, but managing stress, right? We all know how important that is to our overall heart health. And so just a reminder, we will send out slides and a recording at the close of this session, so you will be able to take a look and have those, step-by-step instructions on how to enroll and get started if you are eager to join. So thank you so much. Appreciate your time today.
Thank you.
Thanks, everybody. Take care and stay calm.